Hey everyone, in today's video, we're going to go over a mental health case scenario, how you can proceed when this is your SLA simulation, but also we'll go over some CBA practice questions. So let's get started. And here's your case scenario. You are working in a community mental health clinic and your client is James. He is a 28-year-old male with a diagnosis of schizophrenia. He arrives late for his appointment. He appears disheveled, avoids eye contact, and he is mumbling to himself. He tells you the voices are louder today, and they said I shouldn't be here. He hasn't taken his medication for 3 days, stating he thinks they are poison. He appears paranoid and guarded, and when he is asked if he feels safe, he shrugs and says, "Sometimes I think it's better if I just disappear." Now you can pause this video and think to yourself and maybe write down some notes. What would you do in this case scenario if this is your SLA? And maybe what type of CBA questions you might see if this is the case scenario. Now let's practice some CBA questions and go over some rationales. The first question is, what is your priority nursing action in this situation? A. Encourage James to take his medication immediately. Letter B. Explore James's feelings about his hallucinations. Letter C. Assess James's risk for self-harm or suicide. And letter D. Contact his psychiatrist to adjust his prescription. And the right answer here is letter C. And the rationale for that is this patient is showing suicidal ideation. So therefore, before you can proceed with any interventions, you need to do a suicidal risk assessment. Let's go to the next one. Which communication technique is most therapeutic? And when you do your CBA, you will get a lot of questions like this one. You have to take your medication to feel better. Letter B, tell me more about what the voices are saying. Letter C, those voices aren't real. Let's focus on reality. Letter D, why haven't you taken your medication? Correct answer is letter B. So using open-ended, non-judgmental communication will encourage your patient to talk to you more, right? To express themselves. And also that will build therapeutic relationship with your patient, that will build trust, and that is very important in mental health. So avoid questions asking why, right? Because that is pointing blame to the patient, and that will invalidate as well their experience and what they are feeling. So tell me more about what the voices are saying. You are exploring the patient's feelings and you are validating it as well. Now let's go to the next one. Which of the following would be a sign of acute psychosis? A. Insight into illness. B. Organized thought process. C. Auditory hallucinations and paranoia. And letter D. Compliance with treatment. And the right answer here is letter C. And hallucinations, paranoia, disorganized thinking, and delusions, those are hallmark symptoms and signs of acute psychosis. And when patient is showing acute psychosis, you need to do some interventions right away. And that's it for our practice questions. Now let's go over our SLA step-by-step procedures. All right, now we're doing the SLA. You're in the clinic room, so an actor or a mannequin is portraying James. Your task is to assess him, provide support, decide on your next intervention, decide on your next steps, and figure out how you would proceed. If you made notes, that's good. Go over your notes and compare it with what we have here. Step 1, in every simulation, of course, you need to do your hand hygiene and review all the documents, review the patient's chart. Once you have that, then you have to introduce yourself. Hi, James. My name is Ira. I will be your nurse for today. I appreciate you coming in, is what you can say, or you can say thank you for coming in. You need to maintain a calm, non-threatening body language. Remember, you need to build a therapeutic relationship with this patient. You need to build rapport. You need to build trust with your patient. As that way, your patient will open up to you. They will tell you more about the hallucinations, delusions, and the patient's feelings. You need to establish that first before you can proceed, especially when it comes to mental health. Next is you need to do an MSE or a mental status examination. So you can start with assessing the patient's appearance, their behavior, and their speech. So you can look for patient's hygiene, right? What are they wearing? What do they look like? Next, the speech. So when you're talking to the patient, are they talking very fast? Is it slow? Are they mumbling? Are they talking in tangents? Next would be eye contact. So when you're talking to the patient, is the patient looking at you eye to eye, or is the patient avoiding your eyes, avoiding your gaze? Also, assessing their body posture will tell you a lot about the patient. Do they look open or do they look tense? Those are things you can pay attention to just by looking at the patient. Next is asking more questions about the patient's mental status. So, asking questions such as, how have you been feeling lately? Can you tell me more about the voices? Have you had thoughts of hurting yourself or others? In mental health, it is important to use a calm, open ended questions. So avoid confronting the patient and also avoid dismissive language. Again, you need this patient to trust you, especially if the patient is having command hallucinations. You want to explore more of that. But for you to do that, the patient needs to trust you first. Therefore, you need to ask questions where the patient will feel validated and acknowledged. Next, you need to assess for suicide risk. So if a client says it's verified this appeared, you need to respond with something calm, again, something therapeutic, something open ended. But when the patient is having suicidal ideation, you need to ask questions specifically regarding their intent or their plan. So you can say something like, James, when you say that, do you mean that you've been thinking about hurting yourself? So you need to ask about their plans. You need to ask how are they going to do it. You need to ask when are they going to do it. So you need more information about it, as this will ensure that the patient is safe. So if risk is confirmed, then you need to escalate immediately. Notify your supervisor. You need to notify the physician and any other interdisciplinary professionals that is involved in this patient's case. Next is ensure safety and stay with the client. So you can say, I'm here with you. You're not alone, James. I'm going to stay with you while we get the help you need. Your safety is our priority. So saying something like that makes the patient feel validated and acknowledged, and also makes him feel supported as well. And that would be your priority, is ensuring patient safety. So safety trumps everything else, and don't leave the client alone until you deem that it is safe for you to leave the patient. So for a documentation, as this is something that you need to document, of course, here's an example. So client arrived disheveled, expressed auditory hallucination, refused medications for 3 days, verbalized suicidal ideation, risk assessment completed, supervisor and physician notified is something I would add as well. Client not left alone, plan for urgent psychiatric consult initiated for this patient. For documentation, you can use the SOAP method or FDAR method if you want, as long as it's concise and it's clear and people will understand what you are documenting and it is legible when you are handwriting it. And before we end, here are some tips for your CBE and your SLA preparation. So always prioritize safety, especially when it comes to mental health simulations. Always use therapeutic, non-judgmental communication. You need to build that trust. You need to build that therapeutic relationship with your patient, as that will encourage the patient to open up to you. You need to be calm, supportive, and always patient-centered. Know when to escalate to the supervisor or physician. So you need to know when to call the nurse manager or the physician as well, and also maybe consult with referrals with mental health teams, psychologists, psychiatrists, and other interdisciplinary professionals. Lastly, you need to document, of course. As something to remember, if it's not documented, it didn't happen. So your documentation must be objective, specific, and timely. And that's it for our video for today. Thank you for watching. And if you enjoyed this case scenario and you want more case scenarios, CBA practice questions, and SLA prep, I just launched an online self-paced course where it has video modules of me lecturing about SLA preparations of different case scenarios. It has over 300 CBA practice questions. It has comprehensive modules, nursing skills review, and PDF flow sheets and cheat sheets that you can use for your CBA and SLA preparation and even on the day of your simulation. So if that's something you're interested in, you can go to my website www.nursingcollective.co/course, and when you go to the website, you can just click course and it'll take you to the online self-paced course. We also offer private coaching and hopefully later on group coaching. So if that's something you're interested in, you can go to my website. Otherwise, thank you guys for watching and I'll see you in the next video. Bye! If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!